right, so we have a 61-year-old woman with no past medical history or family history or heart disease who presents with a trimalleolar ankle fracture after a fall. As part of her preoperative workup, an ECG is obtained. A portion of the rhythm strip is shown above. Which of the following is the most appropriate? Okay, so this is a two-step question. And the first part is to take a look at the rhythm strip and interpret the rhythm strip, because that is going to be important to answer this question. And when we look at the rhythm strip, we see a P wave, a QRS complex, T wave, P wave, QRS complex, T wave. So we have a P before every QRS. The only thing I see here abnormal is that the PR interval appears to be a little prolonged. So it is greater than one whole box here, the width of a box. So this is going to be a little greater than 200 milliseconds. However, we see no drop P waves. And so this is consistent with first degree heart block. Okay, so now that we have an ECG, a rhythm strip with first degree heart block, let's take a look at our clinical scenario and try and dissect the question and what it's asking. So the question wants to know which of the following answer choices is going to be most appropriate here. So let's read those answer choices. A, administer IV calcium chloride, insulin, glucose, and sodium bicarbonate. Answer choice B, order serial cardiac biomarkers and admit to cardiology. C, place transcutaneous pacer pads and make arrangements for a transvenous pacemaker. And D, reassure the patient and the orthopedic surgeon that no treatment is necessary. So when we look at this question, the key thing here is that we have a pretty typical presentation of a trimalleolar ankle fracture. And the question is telling us there's no heart disease here and that the patient has no past medical history. So when we are given this information in a question, it's for a reason, right? And so when we look at this ECG, a lot of people will say, well, maybe it's a little abnormal. Maybe we should do a workup or something. But let's go through our answer choices and see why this information of no past medical history and no heart disease and an asymptomatic patient is important. So answer choice A, IV calcium chloride, insulin, glucose, sodium bicarb, that's the treatment for hyperkalemia. We have no indication that this patient has hyperkalemia. There's no peaking of the T wave. There's no widened QRS complex. So answer choice A, I'm going to cross out. Answer choice B, order serial cardiac biomarkers and admit to cardiology. Well, with an abnormality in an ECG and an older woman who's 61, it's something to think about, right? However, in this case, the patient is otherwise asymptomatic. She has no past medical history or heart disease, and really a first degree heart block on an ECG it can be abnormal, right? It's abnormal, but it doesn't necessarily mean that there's disease, right? You could get first degree heart block in young, healthy athletes. You could get it from some medications such as beta blockers. You could get it with individuals who just have a little increased vagal tone than normal. So as long as the patient is asymptomatic, not complaining of chest pain, there's no need to order serial cardiac biomarkers and admit to cardiology. So let's cross that out. Answer choice C, place a transcutaneous pacer pads and make arrangements for transvenous pacing. This patient does not need a pacemaker, even transcutaneous. If a patient has complete heart block, so for example, if this patient was coming in with chest pain, she was diaphoretic, and there was a heart block, we'd be concerned that that may progress to complete heart block. And in those cases, you may want to consider transcutaneous pacer pads. However, this patient is totally fine otherwise, other than the ankle fracture. So let's cross off answer choice C. That leaves us with answer choice D, reassure the patient and the orthopedic surgeon that no treatment is necessary. And I'm going to choose answer choice D. And sure enough, that is the correct answer. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.